Hi, I'm Dr. Tom Lewis, founder of RealHealth Innovations. We're a health creation company, and today we're going to have a workshop on drugs and the side effects of drugs that sometimes might outweigh their benefit. Think about this. Every drug, every pharmaceutical you take in is a synthetic chemical. And I'm a chemist, so I know a little bit about this. So what I often say is that when you take in a synthetic drug, it's like pushing an air mattress under water. Some part may go down, but another part might pop up. So we always want to measure the risk-benefit analysis on every drug we take. And what I want to do is I want to go over some of the major drugs that people are often taking out there, particularly for chronic diseases, and the true side effects of some of these drugs. Now, Real Health looks at people this way. We're inherently healthy. So do we need drugs, or have we done just something to take us a little bit out of balance? And the better way to go is, rather than the drug, work on reestablishing the balance. And what I look at is taking pharmaceuticals, taking medications is really a crutch to your health. Do you need that crutch? Yeah, sure, if you break an ankle, you need a crutch for a little while, but once the ankle's repaired, you don't need the crutch anymore. So if you're taking a drug for life, maybe you should be questioning the diagnosis, the approach. There are probably better ways. But let's look at some of the major categories. So mood-altering drugs. What I have here, Abilify, number one. In 2014, it was the number one selling drug. And so we see there are a number of very large selling drugs that all affect mood. And more common side effects of these drugs, besides making you feel a little bit better from a mood perspective, they really dope you down a little bit. Difficulty with speaking, drooling, loss of balance. You can see these drugs are affecting the health of your brain. But less common would be blurred vision, dizziness, headache. But let's look at some of the underappreciated side effects of these drugs. So here's a study on a mood-altering drug in the treatment of Alzheimer's. And what they found in this Alzheimer's group is that taking this drug increased mortality. So what you're not being told is taking these drugs actually increase your chance of dying and dying young. The next one, an extremely common drug, which is also both prescription and over-the-counter, are the proton pump inhibitors, or the antacid drugs. And we're calling Nexium here the little purple poison for a reason. I'll get into that in a moment here. So if you look at Nexium, it's number 2, Prilosec number 98. Some of the more common things is blistering, peeling, or loosening of the skin, bloating, chills, constipation, but not listed, but now known from studies of people who have been taking these drugs for a long time. And by the way, these drugs are only designed to be taken for 2 to 4 weeks. So if you're taking them longer, there really haven't been studies on the safety at that point. So what we're seeing is convulsions, Parkinson's disease, Alzheimer's disease, and autoimmune diseases. So there's a really big price to pay for taking these antacid proton pump inhibitor drugs. So if we look at the proton pump inhibitors, actually increase the risk of dementia. Patients who receive proton pump inhibitors like Nexium and Prilosec were found to be significantly more likely to be diagnosed with dementia many years later compared to patients who did not receive the PPI. And the translation of the medical research is that there's a 44% increase in risk. People are worried about dementia. This is giving you a 44% risk. Get off these drugs, solve your acid reflux problems other ways, and you've significantly reduced your likelihood of having dementia or Alzheimer's in the future. Cholesterol. Lipitor was the number one selling drug 10 years ago, and Crestor is number 4 today. So these are ubiquitous drugs. 25 million Americans are taking cholesterol-lowering drugs by way of statins. The big side effect, okay, diarrhea, but really the side effect we're seeing is musculoskeletal pain and muscular weakness. So not listed for cholesterol-lowering drugs, the statins are an increase in cancer, an increase in type 2 diabetes, and the really underpublished or underappreciated fact is heart failure. And there's significant underreporting of pain and muscle weakness. Now, muscle weakness, what is the most active muscle in our body? It's our heart. So there's no guessing about why we're seeing heart failure, because these drugs cause muscle weakness, and we're weakening the muscle, the heart muscle as well. So it has severe consequences on our overall health. There are studies that show taking statin drugs reduce the efficacy of exercise because their muscles are weakened by this drug, so it's not a good combination. Here's some more on the cholesterol-lowering drugs. Total cholesterol levels are inversely associated with mortality in dialysis patients. So people with kidney disease, the higher the cholesterol, the better they do. So what's all this cholesterol lowering about? Population studies in Japan show that people of all ages with higher cholesterol live longer. So there's a lot of controversy about the true efficacy of these drugs. And here's a paper published in Mayo Proceedings, Mayo Clinic, the top clinic in the world, showing that, and this is for people 65 and older, that the higher your total cholesterol and the higher the LDL, actually the less mortality you have. And here's Proton magazine, Mass General Hospital, Harvard Medical School, saying that statins don't seem to confer the ultimate health benefit. Yes, they lower cholesterol. Yes, they lower cardiovascular disease in people with already severe cardiovascular disease. But these people aren't living longer, so they're dying of other things, like the cancer, like the type 2 diabetes, that is not being considered in some of the publications touting the benefits of statin drugs. So they have severe side effects. So a little bit more on statins. Statin therapy increases type 2 diabetes by 18 to 99%, depending on what study you're looking at. Here's a Harvard study on 65,000 people, men and women, 38% increase in diabetes, and this is published in the American Heart Association Journal. And then postmenopausal women in the Women's Health Initiative, 154,000 women, statin use at baseline was associated with a significant 71% increase in type 2 diabetes in the women on statin drugs versus those not on statin drugs. So severe consequences for what I consider relatively minimal benefit. The next drug class we're going to look at is blood pressure meds. And right now with the new standards, almost 50% of Americans qualify on these new standards to be treated with blood pressure lowering drugs. So if you're likely to be on a drug next time you see your doctor, and we're seeing all kinds of side effects, diarrhea, constipation, headache, feeling of tiredness and weakness. Your brain is regulating your blood pressure, and if drugs are down-regulating or lowering your blood pressure, your brain might not be getting all the blood flow it needs to be working efficiently. So you can see a lot of these side effects are related to maybe not getting enough blood to the brain. So there's strong evidence that ACE inhibitors, a type of blood pressure med, is linked to kidney disease, and diuretics are stripping us of minerals, and our bones are made of minerals. So there's a consequence to taking diuretics as blood pressure medication, particularly when it comes to bone density. And then beta blockers are affecting our brain, our memory. So there's consequences. Once again, we're pushing the mattress underwater. We're lowering blood pressure, but other things are popping up somewhere else. Next one is Nsaids. So we're looking at aspirin, Motrin, Advil, ibuprofen, Aleve, a class of drugs that almost everybody in America is taking to relieve pain. No one wants to be in pain, but there's a price to be paid for taking these drugs, maybe not once in a while to relieve pain, but if you're taking it frequently every day, there are significant consequences. So dyspepsia erosion, basically we're talking about affecting the very delicate gut lining. And what we're seeing is, and there's all kinds of blood flow in the kidneys. We're seeing renal dysfunction, kidney failure. We're seeing blood pressure affected. We're seeing heart failure. And we're seeing blood loss from affecting the lining of the stomach. Stomach ulcers, things of that nature come from taking something as simple as an NSAID. So autoimmune disease, when the body attacks itself, what we're seeing is the drugs that are being prescribed for these autoimmune disease, which is our inflammatory diseases, have a significant consequence. So one for autoimmune disease, anti-inflammatory, is Prednisone. And Prednisone is very commonly taken, but what it does is it increases risk for bone fractures. Prednisone literally strips, we can see with dose, going from less than 2.5 mgs up to greater than 7.5 mgs per day. And a lot of people are on prednisone, these steroid drugs, for long, long periods of time, that we see a significant increase in hip fracture and vertebral fracture. What's happening is these drugs are stripping calcium from our bones. Once again, there's a price to pay for reducing your overall pain burden, and your bones are paying a heavy price. So warfarin, anticoagulants. So if you have a likelihood of stroke or you're having blood clots, you're going to be put on an anticoagulant. There are natural anticoagulants. For example, fish oils would be an anticoagulant as well. But major side effects of warfarin, one of the most common anticoagulants. Bleeding gums, you're not clotting. Blood and urine, you have internal bleeding, bad sign. Unexplained nosebleeds, bruises, dark, sticky blood stools. So these are significant problems associated with the fact that you're clotting. There are better solutions, diet, lifestyle, supplements that can reduce your need for these clotting drugs or anti-clotting drugs. And there are quite a number of studies that have shown fracture risk with warfarin. It's about double with non-warfarin users. So once again, women concerned about bone density might be on a blood thinner. The blood thinner is contributing to the loss of bone density and increase in fractures. So there's a price to be paid for this drug. Now this is a picture of Arnold Palmer, who died last year. He was on not warfarin, but he was on Xarelto. It's one of these new anticoagulants. But what happened is, the month before he died, he had major bleeding, internal bleeding, and he went in for surgery and he lost his life on the table. So even though he was advertising this drug, it probably took years off his life and contributed to his early demise. So whenever you're assigned a drug, you've got to realize, and when you see the ads on TV every evening and daytime, whatever, that there's a risk-benefit ratio. Half the drug ad is talking about side effects. And a lot of side effects, the clinical studies on these drugs are short. But if you're taking a drug for 10 years, you're in no man's land where we really haven't studied the long-term side effects. You should consider alternatives. The drug should always be a secondary or third-degree treatment for one of your conditions, whereas lifestyle, supplementation, better behavior, things of that might be a better alternative considering the risk-benefit. So I hope you enjoyed this conversation on the side effects of drugs. I think drugs have a place for short-term acute diseases, but in a chronic state, taking a drug day in and day out for years, there's probably a better solution. My name is Dr. Tom Lewis with RealHealth Innovations. Thank you very much.